Employees at St. Joseph's Hospital in Comox are coming forward with allegations that the hospital is not a safe place to work. The Hospital Employees Union says on-the-job injuries have skyrocketed over the past few years, and they say some of the injuries can be linked directly to low staffing levels and overworked employees. The HEU says the frequent injuries and the resulting time off for staff members is having a negative effect on patient care. Our Gord Kurbis has the story.
It's supposed to be a place where people come to for their medical attention, but workers at St. Joseph's Hospital say the hospital itself is actually the source of many medical problems.
We think it's because they're rushing, they have workload issues, and because they are trying to care for the patients. That's what they're there to do.
The union representing healthcare workers at the hospital is concerned at what it says is an unusually high number of on-the-job injuries. It says looking at numbers for the years 2008 to 2009 and comparing them to the period of 2009 to 2010, accidents within the hospital have skyrocketed by 81%.
Well, I think it's important for people to understand the work that we do and that it does hurt us sometimes, and that we need to see improvements in levels of care so that they can work safely and make sure the care is given.
The union says the biggest increases are happening within St. Joseph's long-term care facility. Tamara Hudson works as a care aide in the department. Last year, she was off for 10 months after being injured on the job.
I was making a bed, going around to bed, and I had an arm of laundry, went around to bed, and a cord was on the floor, and I tripped over the cord.
Hudson agrees with the union's assertion that reduced staff levels are the main reason behind the injuries.
We've been worked to our limits for the last few years, but we continue to get small things added on to our tasks for the day. So we get another 10-minute task added on. We're burning out, we're getting run down, sick time is increasing.
Information provided to us from WorkSafe BC confirms the number of claims generated by staff over the past several years.
I believe they've done some regular inspections, and we know the employer's very concerned as well, and they've been taking some measures to try and alleviate it, and we've seen a slight decrease in the numbers of claims in the last this fiscal year.
Management at the hospital was approached for their reaction to our story, but have yet to provide any official comment. But off camera, one hospital coordinator told me he was surprised the union had concerns, saying the situation at St. Joseph's has been improving. He also noted that accidents at healthcare facilities are not unusual, and St. Joseph's has also formed a Safe Start Committee to help alleviate the problem.
Hopefully this new program, this new training program we have will work, but it will only work and we'll only see changes if the employer provides us with the resources that we need.